Hi guys, so I'm in the library right now and I am in a study room, so it feels like old times. It's very actually comforting for me to be in here because I spent so much time in here when I was doing my prereqs for nursing. So it's a place to come and get, like be alone and study, and like I just got so much accomplished when I always came to the library. I don't know how many resources you have on your university campus, but our particular campus has a library that is humongous, and they have several different study rooms. I'm sure you've seen that from when I did my post before, and so it's a lot of fun just to be in this atmosphere because I wouldn't say fun. It's rewarding because I know I'm going to get a lot accomplished. I have to make sure I'm not showing anything. I have to really be careful with all of this. And that was my shoe. So I'm just basically going to be diving into, I'm going to finish my math. I have dimensional analysis that I have to do, and then I have my geriatric portion of the nursing that I want to get caught up on. And then we have our first test coming up, like I said, next week. And that's for fundamentals. So I really have got a lot, and I mean a lot of studying in that particular area, even though I have been studying and I've been doing all the homework. It's still, I don't have everything completely memorized. And of course, when you start learning how to test as a nurse, it's not like black and white answers or yes or no answers. It's figure this out, put all the knowledge that you have, everything that you've researched in this chapter, and fix your patient. So I know that's what they're going to be doing to us because that's how it is. So I just wanted to hop on here and say that I won't be coming on here the rest of the week because there's going to be nothing to do. The class that we're going to have tomorrow is actually going to be a different type of session just because our instructor is going to be gone. So we're going to be doing the online portion. She'll be teaching us through the online part. So anyway, it's really exciting, guys. Like, it's really exciting. And we got fitted for our scrubs today. That was super fun. Oh, yeah. So clinicals, they were today, right? And we did sterile technique with the gloves, how to do sterile gloving. And I failed the first try because when you put your fingers into the gloves, like sometimes they don't go in there correctly, like they're on the right finger, and it's just kind of like dangling. Well, you can't touch it with your other hand because your other hand is unsterile. It's dirty. It's not clean. It's not sterile. So you have to wait till you put your other glove on in order to fix it to where you can get your fingers in there the correct way. So I knew that, and I was talking through it. I was just like, this is exactly what I'm doing, and this is why. Well, the dangling finger, as I was trying to put on the other sterile glove, actually came by and hit my wrist, I guess. I didn't even notice it, feel it, or see it. But my proctor definitely noticed and failed me in the checkoff. It was terrible. I was mortified, and because I was just so confident that I was going to pass that because I had practiced 100 times, and I was just like, I got this down. Boom, 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 boom. Those are just things that I guess you don't think about because we don't think about them because we're students and we're not in that profession yet, and we haven't been through all the scenarios. So I was actually, in a weird way, thankful that it happened because it was like, oh yeah, this could happen. This could happen, and this could. No, it just kind of opened up my brain to think about other scenarios. Because I was just thinking big, like, don't let your shirt touch the table, or, make sure you don't have your hands down too low, and all of those big, basic things. Well, those are so big and basic, obviously. I learned a lot. I'll just tell you that. I learned a lot just in that one little session. And so now I'm going to be going back, and I did recheck the skill with another instructor because that's the way it works here. Thankfully, I passed. And I almost didn't because the gloves, you can't help how the gloves open up in the package. You have to open up a brand new sterile package every single time. And so when you open it up, sometimes the gloves, if they're not just perfectly laid out for you to stick your hands in, tough. You got to figure it out because they're not always going to be perfectly laid out. Sometimes they're bunched up or they're flipped over the wrong side or they're, half folded or whatever. So there's going to be situations like that, and you have to figure out because you don't have time to just like, oh, well, I'll just go get another one, because if you're in an emergency situation, you don't have time for that. So you got to figure it out. So she was really serious when she told us, this is a huge deal, and you better have this down pat. And I wasn't the only one. I can't say that. I'll just say I was the only one. But it was kind of, it was nerve-wracking because you think you have it down pat, and then something happens. Something super tiny happens. Either you touch the outside edge of the package just barely because you're pulling it, or you step too close to the bedside table or whatever you're putting your sterile field on. You lower your hands too low, or you touch the wrong part of the glove when you're first starting out. Yeah. So practice. And I did notice that with my particular program, what they taught us, I had already researched some YouTube videos, and the YouTube videos were slightly different than what I learned. So it's good to have the YouTube videos or other people to be able to watch, but just make sure that you're looking in your own resource, your own book for your program, and that you go exactly by what the wording in that book says. Now, there were some things that she adjusted for us that she said, okay, your book says this, I will allow this. And so that was very reassuring. But you have to really pay attention. Like if you were up using the bathroom during that time, which technically you would not ever be doing, you just have to pay attention. Pay attention to every single thing your instructor says. Make sure you know exactly what your book says, especially if you're going to other resources to learn either ahead of time or in addition to what you're learning. So, I think that's all I have to say today. I guess. I don't know. It's like a huge... I've almost made it through the second week of nursing school. And I do have a lot of studying. I'll tell you, the studying is no joke. Like, it's no joke. And I've been studying every single day, but I don't have the memorization down. Like, if they just gave me a comprehensive, detailed test of just covering the stuff that we've already covered, I don't think that I would pass it, honestly, because I don't know it well enough. Yeah, I've read over it. I've done homework over it, but I don't have it like, boom, I don't have it in there. I certainly don't have it in there long enough. I mean, well and deep enough to pull it out and try to save a patient's life. So, at this point, I'm not saving a patient's life. I'm giving them bed baths and brushing their dentures and, the newbie nurse stuff. Anyway, so everybody have a great rest of their week and weekend, and I think we're going into a holiday weekend. So, everybody have a great time, and I will be back on here to see you guys next week. It will be week 3 of nursing school. Everything's great so far. As much studying as you can do before you get into the program with those tiny little things like the terminology and just really knowing your systems from A&P. You're going to be golden. If you can get study guides. So one of my workbooks had a study guide book to go with it. They have never really mentioned it in our program, but somewhere in the paperwork that they gave us, it did say this is an additional resource for you. I ordered that book, and I haven't gotten all the way through even the first chapter of when we started the first chapter. I haven't gotten through all of that because I've been doing all of the other things that have kept me very busy. But I plan on doing that because that's the test that's coming up this next week. So I plan on getting all 5 of those chapters completed in the additional resource. And I'm also using the online stuff that goes along with your textbook. So if you are using secondhand stuff, you might want to see if you can go on and order a key code to use for the book that you're learning from, because it has lots of online quizzes and reviews and things like that. At least my textbooks do. So anyway, that's all the advice I have right now. Nothing going on this way. Just gonna be studying for 4 days straight so that I can get it down. Anyway, I'm rambling now. I'm so sorry. I'm gonna stop rambling. I'm gonna stop doing these end of the session ramblings, and I'm just gonna start saying bye. All right, guys, bye.